I'm a professor of health policy at George Washington University in Washington, D.C. I also direct a Center for Health Policy Research there. And so what I do is I study healthcare issues and I teach. Well, I came to work with Methodist for a couple of reasons. I had been doing work on Medicaid for quite a long while, had done a study that talked about sort of the issues about where there are going to be enough primary care doctors across the U.S. When a Medicaid expansion occurs, that got published in the New England Journal of Medicine, and was presenting it at a conference, and Ed was attending and thought it was a subject that was of great relevance to Texas. I was delighted to take him up on the offer to do this work because I'm a Texan. I grew up in San Antonio. So the main finding was that Texas has a very serious problem of a shortage of primary care providers, so family practitioners, internists, pediatricians, OBGYNs in general, and in many parts of the states, particularly in rural and poor areas of the states, it's really quite shocking. There are a number of counties in Texas that don't have any primary care doctors at all. About a quarter of the state, there are actually fewer today than there were 10 years ago. There are shortages that are really quite appalling. Now, the other thing that we found is, so this is how things are, was that if there are the insurance expansions under the Affordable Care Act, both the Medicaid expansions as well as the health insurance exchanges, this will increase how many people have health insurance, so they'll be wanting a little more care. So it'll cause a little bit of tightening in that market. So it causes some short-term problems. And that part of the message in the report was that Texas needs to think about how it wants to try to deal with these issues because it already has a problem, and the problem is about to become somewhat worse. The solution is multifaceted. In part, Texas needs to sort of figure out ways to increase the number of doctors who are practicing in primary care. So some of it is trying to increase residency slots for people who graduated. Partly it's also trying to expand the use of people who aren't doctors, who are nurse practitioners, who are physician's assistants in care. Part of it has to do with trying to think not only about the total number of healthcare providers, but also how many there are in different areas. So again, there are certain parts of the state that are just very underserved. And so there needs to be a way of trying to figure out how to redistribute the health manpower that's already there. The Medicaid expansion debate is not surprising. I've been dealing with this for a while and actually have been doing work in a number of states looking at Medicaid expansions. And the debate in Texas parallels the debate in many other states. The thing that's interesting is that a number of states that were conservative states headed by Republican governors have decided that they want to go ahead with the Medicaid expansion because they see why it's both beneficial for the population in their states, as well as it's a good deal economically because it'll attract billions and billions of federal dollars that help improve the economic development of the state. The thing that's interesting in Texas is that Texas appears to have been a little less willing to go down that route. The hearing I was at today made me think, well, gee, there are some legislators in Texas who see the benefits of it, how it'll all play out. I'm not sure. It'll be interesting to see how the debate continues on. And that, of course, it's not all something that is going to be resolved right away. Some of these things may take some transition time. So even if not now, Texas may decide to expand Medicaid at some point in the future, and I sure hope they do. There are all sorts of arguments about how it's good economically, but part of it is Texas is so low down on the scale compared to other states in terms of how well they treat their own citizens as far as getting access to medical care. It's a shame because Texas, the people of Texas are good-hearted. It's a state that has lots of resources. But that somehow I think that there have been ideological views that have gotten in the way of what are otherwise, the good instincts and preferences of the people of Texas. As far as the data that we produced, what I'd hope is that it generates some more debate and discussion in Texas and makes people realize that in addition to thinking about the Medicaid expansion, that they begin to think about what are ways that we can really bolster our primary care workforce, that this is something that not only are people in Texas looking at, but that people from outside Texas are also looking at. And maybe Texas will feel like, gee, it would like to rank, do a little better in the eyes of other states too. But I'll be honest and say, research is important, but a lot of it is the political will that goes on, and the goodwill of people to sort of decide how can they sort of come to make compromises among different parties in the state so that they can do things that advance the public good.